Hello, and welcome to my presentation on social media and the adolescent. This is Megan Parker from Cornerstone University. This literature review provided an overview of the current research that exists on adolescence, social media, and its relationship on anxiety and depression. As it might not be so obvious from this picture, for adolescents, the influence of peers during this time frame is high. But the reason it looks different is because the internet has changed the context in which the adolescent socializes and forms their identity. The internet's more anonymous, allowing for exploration of identity in a non-judgmental and often parent-free environment. It is clear that social media is becoming commonplace in an area that needs more research. According to a recent study by Pew Research Center, 69% of the population engages in social media use, and of those users, 88% are between the ages of 18 to 29. The research questions that are addressed in this review are: what factors play a role in the adolescent's risks of using social media? What are the benefits of social media for adolescents? And lastly, what are the applications of these benefits of social media in treating depressed or anxious adolescents? In doing this research and addressing those questions, some major themes emerged. Overall, the literature is mixed and points to both benefits and risks. When addressing the factors that play a role in the adolescent's risk of using social media, personality as well as pre-existing conditions emerged as a theme. Pre-existing clinically diagnosed depression and anxiety were indicators of problematic social media use, as well as negative perception of experience while online. You can see there some examples of problematic social media use, which could include oversharing, stress posting, viewing triggering posts, privacy concerns, as well as risky behaviors. In terms of personalities, those indicated different uses of social media. For example, extroverts join more platforms and use social media sites more frequently. Introverts tend to use social media more passively through browsing and scanning news feeds. These findings have the potential implication to personality tests. One researcher used social media language to obtain automatic personality tests through social media sites. Pretty neat if you ask me. However, most of the research suggests that there is no outright link to social media use causing as a direct cause of anxiety and depression in adolescents. We should take a minute to review the positives, the benefits, and the risks of social media use, especially before we talk about the potential implications of these findings. The benefits that emerged through the research were social connectedness, self-esteem, self-expression, identity formation, life satisfaction, and perceived social support, while the risks were loneliness, sleep deprivation, anxiety, depression, social comparison, and fear of missing out. Social media sites could be used to gather data and serve as screening tools to identify those at risk for anxiety and depression. Posts, tweets, photos, those can all serve as indicators of well-being, leading to earlier identification, which ultimately could lead to earlier treatment of anxiety and depression. Social media sites can also serve as an outlet for group support and therapy in populations that are otherwise marginal and stigmatized, such as those with mental health problems often are. Social media use and patterns could also guide treatment plans as well as counseling about social media use. Clinicians can help adolescents reflect on their social media use, help them to understand their patterns, and lead them to healthier uses of social media with the findings that were found in these research studies. So contrary to my personal a priori hypothesis that there would be more risks of social media use in the adolescents rather than benefits, there is little to no evidence that social media use itself directly causes increased rates of anxiety and depression. Quite on the contrary, there are many identified benefits and protective factors outlined in the research. So this leads me to my question for you. What blinders do you have in your way of getting into your research study? How did your own a priori hypothesis, biases, and assumptions get in the way? And most importantly, how did you overcome this to deliver an objective, non-biased review of the literature? Here's what happened when I took off my lenses and got a healthier view of our adolescents. Thanks for watching.